Well, today's lecture, we're going to be discussing gastrointestinal disease in the first year of life. We're going to discuss to farmers how they can minimize the risks. Now, foals by 6 months of age, greater than 20% of foals in the United States will have some sort of infectious diarrhea. That's the National Animal Health Monitoring System back in the late 90s. Doesn't mean your animal is going to be sick. Doesn't mean it's going to spread the disease all over your farm. It just says if you would end up testing these foals, you'll find an infectious disease. The interesting thing is, for adult horses, there's only a 45% diagnostic rate for equine enterocolitis. So it's inflammation of the small intestine and large colon. And believe it or not, that is better than humans. And as we're learning more and more about the microbiota of the horse's intestinal tract, that is the intestinal microorganisms, the bacteria that are within your intestinal tract. If your animal is placed on antibiotics and they get diarrhea, there's only about 50% of those will be diagnosed, and you'll be able to figure out why they got diarrhea. Sometimes it's an opportunistic bacteria, like Clostridium difficile, that may come in there, or it could just be simply changes in your microbiota. You have altered the normal bacterial count within your intestinal tract. Therefore, it can cause an imbalance and hence diarrhea. That's why you cannot diagnose over 50% of these. Next slide, please. So when we discuss diarrhea, we need to understand the mechanisms. And it's either going to be infectious or non-infectious. And when you think of diarrhea, there's also two major categories. The malabsorption aspect of diarrhea. So it's your intestinal tract's inability to absorb the water and electrolytes. And what happens is the water and electrolytes end up hitting the hind gut. And then what you're going to end up getting is getting an osmotic diarrhea. Fluid from within the extravascular and vascular space will come into the GI tract. At the same time, if you can't absorb certain nutrients, it's going to hit the hind gut, and then it's going to become a fermentation vac. And that will, in essence, bring in more water and electrolytes into the gastrointestinal lumen. And then there's secretory causes. These are usually caused by enterotoxins, toxic bacteria produced that cause severe inflammation of the bowel, and hence leakage of proteins, leakage of fluid from the vascular space into the lumen of the bowel. Next slide, please. So this is a schematic drawing looking at inflammation and diarrhea diseases. And what we're going to look at the left-hand side, upper left-hand side, you're going to see toxins. And that's released by the bacteria. Well, those toxins, which is depicted as green bacteria, ignite, so to speak, or cause a cascade of events with the white blood cells. And they're depicted right in the left-hand side of the screen, as well as the middle of your screen, are some white blood cells, and they release factors called cytokines. And what they do, that is the call for help. That is the SOS. That's the 911 signal. And they start recruiting a variety of different other platelets, other white blood cells to get into a battle. And they start to marginate or actually cling onto the vessel wall. And you can see them right in the middle of your screen, how they kind of look like they attach to the blood vessel wall. What that does is causes more inflammation because they can release oxygen-free radicals that can damage the blood vessel wall. You can leak proteins. And what you can see in the bottom of the schematic drawing are different aspects that we as veterinarians can administer to our patients to help mitigate the inflammatory process. That's either from non-steroidals, so flunixin-melamine, your plasma. Then there's preventative measures, sometimes your hyperimmunized plasma or serum. Next slide. So we think about, in the first year of life, causes for non-infectious diarrhea in these young foals. That can be anywhere from foal heat diarrhea, they nurse well, there's no fevers. We don't really understand it. It seems maybe to be a normal development of the GI flora, because even orphan foals that are not on a mare, will develop this foal heat diarrhea. So we used to think there was something within the mare's milk, but maybe it's just normal development of the GI flora. Dietary issues. These are these foals that may be consuming the mare's feed overly aggressively, or these orphan foals that you're supplementing and you may be giving them too much folac. or not mixing up the nutrition correctly. These are just some examples. Sand, some of these animals that will ingest sand, depending on what region of the world you live in. And then there's cases of the newborn foal where the client gets overzealous with the enemas. They come in and we find out they're just getting too many enemas and they end up getting a diarrhea from that. Next slide. So causes for foal infectious diarrhea. The number one cause, pretty much throughout the world, the prevalence is rotavirus. Depending where you're located in central Kentucky, it's going to be 20 to 25%. In some regions, it can be up to 60% of diarrheas that are diagnosed as infectious in foals. That can be anywhere from a few days of age up to 3 months of age. Next slide. Next one. Salmonella. This Clostridium perfringens type A, B, and C. Then you're going to be having C. difficile. You can also have Enterococcus durans and hyrae. It's a new bacteria we're finding that's causing diarrhea in these young foals, usually less than 10 days of age. Rotococcus equi. It can infiltrate the bowel. We know that. Cause abscesses within your mesentery lymph nodes. Cryptosporidium, there's some debates. Is it really infectious disease in foals? In central Kentucky, it seems to be a co-infection. Cryptosporidium by itself does not cause diarrhea in central Kentucky, but other areas in the world, it could be a factor. Then, of course, you got to think about your parasites, your ascarids. And these can be affecting these foals that are 2 to 3 months of age. They have some juvenile parasites, and what they'll end up doing is, due to the resistance we're seeing across the world with parasites, and cause impactions. Just this week alone, we had to do surgery on 3 foals due to ascarid impactions. And these foals range in age from 2 to 3 months. Next slide. So when we think about diarrhea, think of these gastrointestinal ailments. They are life-threatening, especially these newborn or neonatal foals, less than 2 weeks of age. Because these foals, just a little bit of diarrhea can cause them to go into hypovolemic shock. So, and even hypotensive. So hypotensive is low blood pressure. Hypovolemic means you don't have enough circulatory volume within your blood because you're losing it out of your diarrhea. And then they can get to septic shock. This is an instance where a foal has Clostridium diarrhea and they get a bloody hemorrhagic diarrhea. So it's so important to be able to get on top of these right away and have your veterinarian come out and be able to do a clinical assessment. Because these foals, by the time they start showing hypovolemic and septic shock, you're already watching Rome burn. We're too late. And now we're going to end up being behind the 8 ball. And why is that? When you think of these young foals in one study, neonates, so less than 2 weeks of age, foals that have diarrhea, there's a study done in University of Pennsylvania, in which we're going to show you the manuscript. And out of that retrospective study, do you know what percentage of foals had bacteria in their bloodstream? These are just foals. Not all of them were extremely profoundly sick. Now, all of them had to come to the university, so they weren't dying, but they needed some fluid therapy, needed some more supportive care. You know what percentage of them had bacteria in the bloodstream? Up to 50%. And so if you, next slide, please. And so what you're going to see is up to 50% of these animals end up having diarrhea. Bacteria in the bloodstream. And it didn't matter if it was gram-negative or gram-positive. It was almost 50-50. So what's that telling us as a clinician? Is that these young foals that have diarrhea should be placed on an antimicrobial. It should be broad spectrum, because you never know what kind of bacteria is going to be in the bloodstream. It's going to be a coin toss. And if you do not treat these animals appropriately, these are the youngsters that they come home, they recover from their diarrhea, but a week later they pop a joint or they pop a bone infection. Because guess what? It's because these bacteria migrated out of that inflamed bowel into your bloodstream. Next slide. So diagnosis of diarrhea. So it's very difficult because there's many different causes. We just talked about non-infectious, infectious cause. And they all pretty much look alike. You know, Clostridium doesn't look anything different than Salmonella. So the main thing is you want to obtain some sort of clinical history. As us as veterinarians, and you as a client, if you get a horse that comes into your stable that's new, it's only been there for a week, and the foal gets diarrhea, you may want to call the owner and ask, have any other foals been affected on your previous farm that it came from? At what age are these foals affected? Just to give you an idea of what kind of diarrhea, infectious diarrhea, could be the culprit here. Has it received any medications? Have you altered the microbiota of that animal? Were you treating for rotavirus pneumonia, and then all of a sudden the animal developed diarrhea? It could be antibiotic induced. You take them off the antibiotics and sort of give their GI tract a rest. And then, of course, you get these animals that are off the nurse, just not doing right, doc. They got the milk face, so they're going under the udder and the mare's just squirting milk all over their face. But they don't have diarrhea, the client tells me. But when we go out there, we'll ultrasound and we'll see a colon full of diarrhea. They may have what they call an ileus, so their intestinal tract calls time out, doesn't have the proper motility, and this diarrhea may accumulate within that large colon. Sometimes you need some medical help to try to increase that motility and have them squirt out more diarrhea, or it just needed more time and it can do it on its own. But ultrasonography is sometimes we can diagnose diarrhea before the client even knows it, because the client may just notice them a little off the nurse. Next slide. And this is one thing that really, as a clinician, that I always hear clients go, boy, doc, I know what kind of diarrhea this foal has. It smells like rotavirus. Or my technicians go, hey, Dr. Slovis, this foal in ICU has some diarrhea. It smells like Clostridium. Well, unless you're a dog, I don't know how you can smell, because it all smells alike to me. Because it's pretty much, in these young foals, it's the nutrition milk that can't get absorbed, hits the hind gut, it ferments, and it all smells sweet. Well, the interesting thing, in the British Medical Journal a few years ago, they ended up having a dog by the name of Barney that can actually smell C. diff. It's a unique odor it has. And they actually took the patient's stools that they knew were positive and others that known were negative with conventional human diagnostics. 100% that dog was able to detect in the patient's stools. Then when it went down the wards looking for these patients, it did pretty good at 83%. So Canada actually has its first certified C. difficile sniffing dog in Canada. And it just speaks to the unique odor of this. The sensitivity is greater than 90%. The greatest thing is, it works for food. It's probably the cheapest labor you have. So, interesting findings. Maybe one day we can get this in veterinary medicine, and we can walk these dogs up and down your isolation unit and figure out which animals have what diseases. But this is just kind of tongue-in-cheek there. You cannot smell the feces and figure out what kind of manure, what kind of disease your horse has, unless maybe if you're a dog. Next slide. Other diagnostics. Polymerase chain reaction, otherwise known as PCR. It's a diagnostic test to detect DNA. And what we know about DNA is all living organisms have it. And that's the reason why PCR can detect infectious agents. And it's very, very sensitive. And there's different types of PCR. There's real-time, which is the most advanced form. Most of your diagnostic labs in your neck of the woods, as well as mine, start using real-time PCR. And it's just molecular diagnostic lab. It's like, CSI in the United States, these criminal scientific investigating labs that look at DNA, fingerprints, saliva samples. Well, in veterinary medicine, we can do the same thing. Nasal swabs, fecal samples. We can do this PCR testing. Next slide. And explain PCR testing. So what it is, you end up getting your sample, and you're looking for that one organism. Let's say, for the sake of argument, we're looking for rotavirus here. So what you do, your sample, and you do 40 cycles. Next slide. And next slide. Just keep hitting the slides. Keep going. And what it keeps doing, it amplifies it. And you go through 40 cycles. The goal is to get to 1 trillion copies. Once you get to 1 trillion copies, your computer can recognize it. Your naked eye can recognize it. And so the more evidence, the more DNA samples that you have in your sample, the faster you're going to get to that 1 trillion copies. It may take only 20 cycles if you have a ton of DNA in that sample. So what you do when you get these PCR results back, we ask the lab, how many cycles did it take you to get to a trillion? If it took you 39 cycles, you don't have that much DNA in that sample, which means you don't have a significant load of bacteria or virus, whatever you may have. If you get 20 cycles, that's significant. You had a lot, and that's a significant positive result. That's something your veterinarian can decipher for you. Next slide. So it's talking about traditional real time. Real time is the most advanced. It's very fast. Now you can stay, within 4 hours you can get your sample, and you don't have to wait overnight anymore. If you can get these samples into your lab at an appropriate time, you can run it quite fast for you. Next slide. And next slide. There's a variety of different companies that are out there that are doing now patient-side PCR in less than 45 minutes. That is the wave of the future. If you're having a disease outbreak, your veterinarian may have this in their truck. They can collect the sample, analyze it, detect it. It will enrich it for you in this special machine, and you can get a report less than 45 minutes. They have machines out there currently under investigation and trying to get some validity to them in regards to strep equi. We're looking at Salmonella. We're looking at a variety of infectious diseases that can affect horses that they can get results in less than an hour. Next slide. So when I think about diarrhea, it's an economic impact. It can affect your whole farm. Difficulty because there's a variety of different agents that can cause it. And that's one good thing about PCR is that one fecal sample, just a sample that could be 4 swabs that has a significant amount of fecal material on the swabs, or a size of 1 centimeter diameter piece of manure. And they can run a multitude of different organisms on that sample in PCR. Now, and then a lot of times we treat symptomatically as your primary approach when it comes to diarrhea in these animals. But sometimes symptomatically, you don't know what the cause is. And if you have a big herd, you'd like to know your cause initially so you can prepare yourself and mitigate issues that may be going on to prevent the spread of diarrhea. This is a farm in central Kentucky that was having an outbreak of rotavirus. They had to foal all these mares outside, and we were able to stop it. Next slide. So I'm just going to discuss just a few. To be able to understand how to mitigate problems on your farm, you need to understand some of these infectious diseases. So when you think about rotavirus, it infects the intestinal epithelium. It is a virus. It's very similar to coronavirus. Instead, it doesn't cause respiratory problems, but it is a virus. And what it does, it invades the intestinal epithelium. So those are the intestinal cells. The intestinal cells have a brush border. It is like a shag rug carpet. And all the pretty much the carpet particulate matter, the shag rug, so to speak, at the tips, they have enzymes and they help digest your food. For instance, lactose. Lactose is in milk. What are foals doing? They're drinking milk. And that can help break down lactose with an enzyme called lactase. You can see it on your upper right-hand schematic. It breaks it down to glucose and galactose. And guess what? Glucose and galactose is the energy your foal needs to survive. That is the gasoline. Without that lactase enzyme, that lactose cannot get digested. Next slide. So what happens when that lactose can't get digested? It remains in the GI lumen, and then it hits your hind gut. And guess what the bacteria love to have in the hind gut? Lactose. And it will ferment. You'll get bloated. You'll get diarrhea. People that are lactose intolerant, they eat ice cream, they drink milk, they get bloated, they have diarrhea. It is horrible on them. And that's what happens to these foals. Next slide. So it affects foals less than 3 months of age, usually 1 to 2 days of age. You'll see it on some of these reproductive farms. Here in Kentucky, we'll see it up to 6 months of age, but it's really hardest hit on these foals that are 2 to 3 months of age, believe it or not. Incubation's 1 to 2 days, but the most important thing is species specific. We had a gentleman that got severe enterocolitis on a farm. The infectious disease person at the University of Kentucky called myself and asked, can rotavirus from these foals, he said he's having a rotavirus problem, affect the owner? And absolutely not. There's been rare occasions, immunocompromised people potentially getting rotavirus from an animal. But again, species specific. Next slide, please. Foals may sit up to 10 days, and they can persist in the environment for up to 9 months. Next bullet, please. And some may stay up to eight months. So when you get these foals home, you probably want to isolate them or have personal protective equipment available for at least 14 days. Because these animals, majority of them can shed up to 10 days. Next slide. So how do you diagnose it? PCR technology, we just talked about that. There's also a little kit test called enzyme-linked immunoassay, where you actually take the fecal material and it will go onto a little ELISA card like you see here. And you see a little faint pink line that says your test is positive. This is a human rotavirus test that can be done. It takes about 15-20 minutes. Treatments, a lot of times supportive fluid care, as well as lactase, the enzyme. Same enzyme as what you use in humans that are lactose intolerant. They take the pill before they want to eat ice cream or drink a little bit of milk. Same thing you give to foals, and your veterinarian can help you in regards to how many tablets that your foal should take. Next slide. But here's interesting. We did a study here, and we did those ELISA tests, which is devised for humans. It's also known as a human diagnostic lateral flow device. And what we looked at is that we had a bunch of foals that I thought had rotavirus, but they were negative on the human device. And the human device is for type A rotavirus. Type A rotavirus is supposed to be conserved. A certain outer protein is supposed to be conserved among all type A. And horses have type A too, rotavirus. So I thought that was odd. So we did real-time PCR, and we found 12 of those 35 samples were positive. So we did some sequence verification just to confirm that was really a rotavirus positive, and it was. So it just goes to show you that if you use a human test, it may not be able to detect all of the equine strains. Next slide, please. So treatment, antimicrobials. We talked about why antibiotics, because 50% of these foals that have diarrhea, if they're less than 2 weeks of age, can have bacteria in the bloodstream. Ulcer medications. Neostigmine is a drug that we use to help promote motility of the hind gut, the colon, to allow these animals that have an ileus or an intestinal tract that's called timeout, that does not want to work properly. Sometimes we can kickstart it. We talk about fluid therapy, and then there's a potential preventative, the vaccine. It's a modified lab vaccine. It's here in the United States. I know you have it over there in England too. There's been some questions of the efficacy. 20 plus years ago, or even longer than 20 years ago, they had it here in Kentucky, the vaccine. It seemed to really stop rotavirus. But over the years, we're noticing more and more rotavirus. Next slide, please. And we noticed that, I talked about the type A strain that rotavirus is, and then they differentiated according to some of their outer proteins, and they called it type A G3 strain. Well, many years ago, all the rotaviruses were type A G3. But we started noticing problems. Animals that were properly vaccinated, their foals were still getting sick. So we worked with the University of Kentucky, Dr. Biosecurity. We did 38 farms, 108 foals, and here's what we found out. 21% of the foals that had diarrhea had rotavirus. And that's what we said before in the initial slide. We said anywhere from 25 to 60% of diarrhea in foals could be accounted to rotavirus. But here's the kicker. 26% with that G3 strain. 30 years ago, all of them were G3 strain. Now, 74 are the G14 strain, a strain that just shows the diversity of rotavirus, how it has changed. The question is the vaccine efficacious for that G14? Is there cross immunity? We don't know that answer. But clinically, we know there's an increased number of rotavirus cases over the last 5 or 6 years here in Kentucky that are on animals that have been properly vaccinated. Next slide. Prevention. We're going to be talking about this towards the end of the talk, and how to mitigate these, proper hygiene, proper disinfectants. Talk to your veterinarian. Bleach is not effective against rotavirus. There's other compounds that are effective. And what do you do if you have an outbreak? Foal outside, get out of the environment that has rotavirus, because if you're not cleaning properly, there's no way you're going to be able to get rid of it. Next slide, please. Next slide. Clostridial diarrhea. There's a variety of different clostridial diarrheas. Clostridium difficile, which is a difficult clostridium, and Clostridium perfringens. It's everywhere. I could find these organisms in your home garden. Doesn't mean you're going to get sick. But however, if you're taking antibiotics, or you're going to get a procedure done at a human hospital and are taking antibiotics, you may change your microbiota of your bowel and make you predisposed to potentially get these bacterial infections, especially Clostridium difficile, that is. Next slide. Because when it comes to Clostridium difficile, it's one of the main causes of antibiotic-induced diarrhea in humans. But one thing that's unique about in humans is that greater than 50% of human neonates have toxigenic C. diff. And that's why it's important that if you are, as a human, are on medications and just recently gave birth and you are on antibiotics, these infants can shed toxigenic C. diff and make you potentially more predisposed to getting C. diff. So we want to know that in foals, and we found out foals don't seem to be asymptomatic carriers as humans. But why don't these human neonates get sick? Well, the hypothesis is they have immature toxin receptors on the bowel lining, the mucosa. So they can have these toxigenic C. diff, but the toxin can't bind anything. It's immature. So that's why these human neonates don't have problems. Next slide. Now in adult horses, or adult humans, 1 to 15%. So you don't really see these asymptomatic carriers in humans. And how about adult horses? Very few also in adult horses. Next slide. Now Ontario Racetrack, however, they saw up to almost 10% of these racehorses had it. And I don't know why. They're just something of interest. So they don't seem to be asymptomatic carriers. If you happen to detect it in these foals or adult, it's probably the real deal. Thank you. Next slide. So you're looking at the toxin A is one of the toxins. You got toxin A and toxin B that can affect horses. The schematic drawing, the lower aspect of the schematic drawing are your lining of your mucosa. These are cells, the enterocytes. And what you're looking at, the ZO1 and occludin, they are pretty much special proteins that help with tight junctions of your bowel. What's a tight junction? That is like grabbing hands with your partner, squeezing it tight, so nothing can get in between you and your partner. And what ends up happening, tight junctions also prevent leakage of protein, bacteria from getting into your bloodstream. They're tight, hence tight junctions. But look what happens when they're exposed to toxin A. It destroys these tight junctions. Look at that fluorescent green on the lower slide. It's destroyed. You can't even see where the cells are because everything's been destroyed at the tight junction. So you can't hold hands anymore with your partner. Now things can move back and forth, and that's how some of these bacteria can get into the bloodstream and how toxins get into the bloodstream. Next slide. And I can go with not just C. diff. There's a variety of bacteria that can do that. That's just an example. So Clostridium difficile takes the air. This is important because we're going to talk about mitigation problems shortly. But bedside air samples from most symptomatic patients grew the organism. These were in clinical journals about a decade ago. So what they noticed, next slide, what they noticed is that the control of C. diff in a human hospital can be taxing because they can find it everywhere. It's hard to eradicate because they're spores and they can be resistant to disinfectants. What they noticed with humans that had C. diff, the time of day where they tend to see more aerosolization of the spores. Again, these aren't humans that are defecating in their bed. They go to the bathroom, they come back. They're not like a horse defecating all over themselves or laying in their feces. That when the doctor came into the room and the patient moved in the bed a little more, they noticed more spores. When the patient went to the restroom and moved in and out of their bed, they saw more spores in the air. And also when the food is served in the hospital setting, the food service comes, there's increased aerosolization of these Clostridium difficile. Next slide. So the question is, this is a typical stall in our facility. Look at the dust particulate matter. What are cases in my isolation unit and this animal had Salmonella? This animal had C. diff. Is there potential that these bacteria can aerosolize it to the next patient? These are questions that need to be asked. And there hasn't been that many great documented studies in horses to say yes or no. You think, yeah, sure, but it's something we need to think about when I talk about mitigating risks. Next slide. Clinical designs, keep going, all the bullet points. They're vague. They're just diarrhea. They're anorexic. They're dehydrated. Tachypnea has high respiratory rate. Pyrexia has fevers, bloating. Sounds like any diarrhea. Clinical signs are vague. Next slide. You can diagnose it by, again, looking at toxins in your feces. So get a proper fecal sample. There's a ELISA test, which we talked about. There's a little kit test that can look for the toxin, but these are human-based tests. They try to validate it for horses, and you get about an 84% sensitivity, 96% specificity. And some of the best tests to do are going to be the PCR. Next slide. Because it can differentiate between toxigenic and non-toxigenic strains, because some C. diff doesn't produce toxins. And what it detects, it detects the genes that can produce the toxins. That's what it looks for. And it can look at low and clinically irrelevant numbers sometimes if it takes a high number of cycles to detect. But it's a very specific diagnosis. Toxins are stable when refrigerated for 60 days or so at 4 degrees Celsius. So if you want, you can collect a sample, put it in a refrigerator, and you keep it in the refrigerator for up to 2 months. If you're not sure if you want to test for C. diff or you want to collect the manure, and if you have more foals affected, then you can take out those samples and start testing if you wish. Do not use styrofoam containers because it will bind the toxins, according to the group at University of Kentucky about 2 decades ago when they were looking at that. Next slide. Clostridium perfringens is another Clostridium. Causes necrotizing enterocolitis. That's usually the common food poisoning with humans. Sometimes you'll see that with Clostridium. Abomasal ulcers, sudden infant death syndrome in humans. Next slide. It also can affect foals. And guess what? Normally, now this is a disease that usually affects the young foals. Rarely do I see it at a yearling, a weanling. That'd be more sometimes a C. diff you can, but so C. perf are usually the young foals. Next slide, bullet point, hemorrhagic diarrhea. This is one of the few, this and Salmonella are one of the few that can cause a real bad hemorrhagic diarrhea at times. And this can cause some serious problems. These foals are depressed, they won't get up, and they'll hit them a little harder than you're going to see with the C. difficile. Next bullet point, anorexia, dehydration. Again, now it's starting to look like any other diarrhea when you start to see this. And just keep going through all the bullet points. Higher respiratory rate, fevers, and bloating. Next slide. So this is where it's important, prevalence. What about how prevalent is it in the population? Next. So you're looking at a bunch of broodmares and foals. Foals by 3 days of age, cultured positive. That's culture. So they found the organism. By 8 to 12 hours, 64% of them will be positive. By 1 to 2 months, the foals, about a third of them will be positive. For the culture, that is. Broodmares, right after foaling, it's the highest incidence. About a little over a third of broodmares will shed it in their manure. In this population of foals in the United States, 90% will get it by 3 days of age. So just because you culture it does not mean your animal is sick. You got to be looking at the toxins associated with it. Next slide. And this is where I find it interesting. This is how we can help mitigate issues. And I'm going to be just talking about that in the next few minutes. But what I was trying to get to is look at environmental. Type A is usually the type that 90% of foals will have. Type A doesn't cause that much disease unless it has other toxins associated with it, like beta-2, enterotoxin, net-F toxin. But what I want to get across here is look where they found it. Teat samples, foaling sites, body sites. Now, the next two down the line, the beta-2 and the CPE toxin, those can really cause some problems. Look at that. Teat samples, foaling sites, body sites. We're going to get to this, how to mitigate this. See if we can get to the air. We got rotavirus all over that can live in your environment up to 8 months. And now look at this. I got C. perf that can be on your body sites and your foaling sites. How are we going to mitigate problems? Next slide. It can be a train wreck, but it doesn't have to be. This is where you as a client, as us as a veterinarian, can empower ourselves and be able to mitigate these problems. These are just a few examples. Salmonella, real quickly. Fecal oral route, young animals more susceptible. I'm just going to explain about how this can happen with any bacteria. But Salmonella is more pathogenic, so to speak, in regards to getting into your joints and bone here in the United States. Young animal is more susceptible, but it can affect any animal under a year of age, easy. But why young animals? Less established microflora. We talk about the microbiota in your gut. They protect your intestinal tract from invaders. Less established host defense systems. We're looking at antibodies, the gastric acid, intestinal mucus, lactoferrin, which can sequester iron. Bacteria need iron to live. Next slide. So what they can do, the bacteria can migrate through the enterocyte. They don't need the tight junctions. Remember I showed you with C. diff, the tight junctions, holding hands, the fluorescent green, the fluorescent red, how that was so important to have tight junctions. Well, Salmonella says, forget that. We're going through the front door. I'm not going through the side door. I'm going through the front door. Go through your enterocyte, releases enterotoxins, cytotoxins, get into the lymphatics. They reach circulation through the lymphatics. And guess what? From there, next slide, they get into your circulation, it can hit. That's when you get bacteremia. Bacteremia is pretty much bacteria within your bloodstream, the salmonella. And septicemia is going to be the toxins that are released and cause a cascade of events. And guess where it goes? That upper slide, you're going to see it goes into your bone. Because what happens, you got immature immune responses. You don't have the antibodies of a normal adult. So they can get into your bone. Like you see there's a growth plate. You can see that dark, you see that black line, that's your normal growth plate, but then you see sort of a grayish area outside your growth plate. That is bone infection within your growth plate. Next bullet point. So clinical signs, they can infarct their bowel through a blood clot to your bowel, such as you see here. Keep going, next slide. So septic shock, fevers of unknown origin. They don't have to have diarrhea. And foals can obtain the disease from the mare. We've had up to 19 negative salmonellas on mares that have come to our clinic to fall out. And then during stage 2 labor, when they defecate, get stressed, all of a sudden the 20th sample, it's positive for salmonella. There's no rhyme or reason to it. This is why another way we're going to mitigate problems when it comes to diseases. And I'll explain why. Because when these mares defecate, what do? They defecate, and some of that manure is going to be loose. It goes down the perineum or their hind end, gets into the udder area, and then these foals start to nurse in that area, and they can get salmonella. Next slide. Variety of different treatments you can do. Next slide. So main thing is prevention in regards to disinfecting stalls, wiping the mare's udders, and we'll discuss that and how to mitigate a variety of infectious diseases. Because whatever you can do for salmonella, for C. diff, for rotavirus, for any disease, it's going to come down to proper hand hygiene and proper hygiene. And now with COVID going along, this should just be second nature. Because we've been doing this a long time as veterinarians and horsemen, mitigating infectious diseases. COVID is nothing compared to what we've been through, because we know what to do. We can empower ourselves. Next slide. There has been some vaccines you can use that we've developed here that has helped reduce salmonella outbreaks on farms. I've had over and over again salmonella. It is not approved to ship in other states or across the globe, but it's something we have, with our state veterinarian, we're allowed to do it in our area. And we've vaccinated thousands of horses. Next. Believe it or not, Kentucky does get snow. Next slide. So what are we going to do? How do we mitigate these problems? I just went over a variety of infectious diseases. We talked about Clostridial difficile getting into the air. We talked about salmonella being noted in mare's manure after foaling and potentially get on into the udder. We talked about C. perfringens, Clostridium perfringens, on the body sites, foaling sites, a variety of different areas it's located. And we talked about rotavirus being in the environment forever. So you want to look at your facility. When we go as veterinarians, or yourself as a stud owner, look at your facility. What are some of the problems you have? What are some of the strengths you have? And what can you do realistically to help prevent the disease? I always like to take a visit. I used to be able to do things over the phone with telemedicine. I thought I could, but I did a horrible job because I need to go out there and see. And then I give a written evaluation so the client has something in hand. And then I do a follow-up. I think it's so important. If clients will not allow you to do a follow-up, I won't go out there. So I think it's so important to make sure they follow the steps that you've implemented. Here's a farm that's having an outbreak of Salmonella. And you can see by the schematic of this picture, they got some booties and they got a dip pan there, but that dip pan looks like a horse just defecated in there. And the booties they're using over and over and over again. So even though they're trying to do the best they can, they're contaminating their hands. But when they remove the booties, putting them back on, because these are contaminated. And the dip pan is worthless. You might as well not even have one. Next slide. So here's a barn. Got a beautiful ridge cap, great ventilation. They're having some, this farm is having a Clostridium difficile issue. Next slide. They feel like they got it. They feel like after I came out there, we talked about things. They said, we got this, doc. The facility looked beautiful, but they were still having problems. And what was it? Let's take a look at the next slide. These reusable gowns. These are Tyvek suits. They're quite expensive in the United States. But look at the fecal matter on the sleeve of that shirt. It's not coated. This is after they just walked in the stall for one time. Well, they're using this one Tyvek suit for a variety of people throughout the day. What do you think that Tyvek suit's going to look like? It's going to get contaminated. And then it's going to contaminate your hands. Then these people are going into other stalls with foals that are not sick, and they potentially the spread of the disease. It's important if you have some sort of personal protective equipment, and nowadays it's just tough to find, so you may have to reuse. Be smart about it. Put on your gloves first, then put on the suit, then remove the suit, then remove your gloves. If you have to double glove, then that's what you have to do to prevent contamination of your hands. And these people did the opposite. They put on the suit, then with bare hands, then put on the gloves. And again, you can see how you can contaminate your hands. Next slide. There's a dip pan, the good old Lysol. It's a human disinfectant. That's not good in organic debris and feces. That is Lysol is excellent for a clean surface, like your countertop. You cleaned it, nice and easy. It's not good for urine on your boots, for fecal matter. Once it hits organic debris, within minutes it's going to be useless. And this dip pan has not been changed for 24 hours. How effective do you think that is? That's something, again, that needs to be changed on a regular basis. Next slide. Your personnel. Now, this is a herpes outbreak at a major racetrack that I went out to. This barn is quarantined. There's the horses that had herpes, neurological form, were removed from this barn. They're on quarantine lockdown. The jockey, or the exercise riders, you see the gentleman in the red cap, they hop on a horse in a specific area of the barn. When they come back, their bridles get disinfected, as well as the bits, and nobody's supposed to be handling those horses except for the groom. But what does this jockey do? He walks down the aisleway and starts petting all the horses. I'm just watching them. Then I take a picture of him. He could potentially spread the disease. Educating the client. This could be Salmonella. This has name the disease. And humans could be spreading this. Educate your barn personnel. Next slide. Herpes again. Again, this can go with any disease. I'm just trying to point out things. Look at the gentleman on your left-hand slide. They have a Tyvek suit. He has holes in it. He can barely get his belly in there. I had an interpreter ask him how long has he had that Tyvek suit. He's worn it for 3 days straight. Yeah, Tyvek should be a one-off deal. Wear it and dispose of it. They're disposable. But this is a farm that's under quarantine. They've had herpes horses there. And you know what they're doing? They get in a routine. They sponge the horse off. That's fine. They clean the sponges afterwards, some of them. You know what they do when they're sponging them off? They take the sponge in their nostrils to try to wipe the dirt off the nostrils. This is herpes. It is spread this way, through their nostrils. Equine herpes virus. They're using that sponge. Cleaning off your sponge and just getting the soap off of it is not going to get rid of herpes on your sponge. They can spread it to horse to horse to horse to horse. I was called out to try to mitigate their issues and stop it because you're still seeing some animals spiking positive herpes on their nasal swabs but they weren't clinical yet in this farm. This is one of the reasons I was catching it. Next slide. But guess what, Doc? I know I got some infectious disease in the barn. I got some great brick stalls. So this is a brick barn with a wooden trusses for a roof. And they're going out and they're saying, I'm going to high pressure wash the stall. I'm going to get rid of the disease. But what do you think they're doing it? They're aerosolizing it. I will find salmonella in the rafters after something like this. I've done it before. And we already talked about Clostridium taking the air. What do you think other viruses? You think rotavirus is going to get killed by this? No. What I recommend people is elbow grease. Take a detergent, clean the stall walls first, detergent of your choice, because you want to wash the stalls just like you want to wash your hands. Get the debris off the stall. Then disinfect it. And then if you want to afterwards, you could power wash it to try to get all these dirt that may be still on the stall walls, or you get some chip paint you want to remove. You can do that. But again, I like to disinfect these stalls first before I start using a high power wash, because you can aerosolize the bacteria. A lot of times I'm getting away from the high power washers to just use elbow grease. I'm really not a high power washing fan, but I know some farms like to do it. If so, disinfect the walls first. Decrease the bioburden on those walls. Next slide. So here's that same barn. They did that. That farm had salmonella. I found in the rafters. After they power wash it, I proved my point. I came back, did environmental sampling, still saw salmonella. So they had a professional crew come through the barn and paint the entire facility. They also painted the stall doors. I came back, it was still salmonella positive. I looked around and I tried to see what is still old. Look at the brass door handle on that stall door. That is the original one that was there during the salmonella outbreak. I asked them, did they disinfect it? They went, no, we just what we did when the painters came, we took all the door handles off, we put them in a bucket, we kept it in this room, and then when the stall doors were done, we came back and put them back on the stall doors. So then what I did is I sampled everything in that stall for salmonella, just did a Swiffer or electrostatic wipe. I wiped it with the stall and used that as my so-called Q-tip. And then I sampled the handle itself. Well, guess what? The stall was negative. All the hand traffic areas, including the light switch, was negative. But the bloody door handle was positive. Again, if I didn't come out there and do my follow-up, this farm would think they have done a great job, and they would have got salmonella all over the people's hands, into the foals' mouths. It still would have been a nightmare. We mitigated the problem. We did not have a problem right now for the last 8 years. Next slide. We talked about how Clostridium could be in the environment, teat samples, foaling sites, body sites. What are we going to do about this? If you can see Clostridium in these sites, you know you can find other pathogens. Next slide, please. Wipe the mare's udders off. Each one of these towels, they do this in dairy cattle. Why can't we do these with horses? Some of the old farm people say, you know what? The smegma between their teats, it'll help establish a better microflora for my foal. I'm not wiping the teat off. If you want to go to old school thinking, that's fine. But this is a new age. Wipe the udders off. You just use the cattle products. It's safe for cattle. It's going to be safe for your horse's udder. Those towels, they're pretty good integrity. I'll wipe the mare's rear end off. I'll wipe their legs off. I'll wipe anywhere that maybe a foal may try to suckle on. Especially if you're foaling out in the winter, you can't give an animal a bath in the middle of the winter. These are some options you have to decrease the bioburden on your mare. Next slide. Foaling kits. Everybody has a foaling kit. Got to have that foaling cart. One thing I do like, you're going to see the right-hand side of this picture, you're going to see some little plastic cups. That's where they put the umbilical dip. They use it once, they throw it away. So you don't have a decreased chance of spreading the umbilical infection from foal to foal to foal. But however, this farm is having a bad rotavirus problem. And they gave every foal an enema when it was born. Twice. When it's born and then the next day. And guess what? They use the same enema bucket in the lower left-hand corner of the screen. We implemented a strategy of how to keep their facility clean, the foaling cart more organized. And all of a sudden, it's amazing how rotavirus can just disappear. And they have not had a rotavirus problem for the last 3 years, knock on wood. Next slide. Another foaling cart. Again, these foaling carts are fine, but they should only be taken out if you have a significant emergency. It should be kept with emergency medications, not for everyday use. These are too big, too clumsy. This farmer's having C. diff. They claim they're cleaning their cart, but you know what? Underneath, when you open up the drawers, on your right-hand side, you can see a little metal strip. Well, you got to put your fingers underneath there to pull out the drawer. Guess what? C. diff was all underneath those. It wasn't on the cart itself, underneath areas where your hands are going to touch. So what do you do to mitigate this? Next slide. Towels. People always wash off their foals with towels, and then they put them in a washing machine with a little detergent. But if you have a disease outbreak, the detergent alone won't resolve things. You're going to have to add some bleach if you want. Use the detergent first, get the organic debris off your towels, and then wash it again in another cycle with bleach, about 1 cup of bleach for about 4 liters of water. You can find out on your washing machine about how many liters it will require. And you know, to fill up your washing machine, you can determine how much bleach you want to use. Next slide. Foaling kits. We utilize foaling kits. Instead of a foaling cart, so depending on how many foals you plan to have in a day, each foaling kit comes this sort of looks like a grooming bucket, so to speak, or grooming kit. We have hand wipes. We have a spray bottle for spraying the umbilicus. We have a towel that can be used. We have chains that are in plastic bags. We have fleet enema. And what they end up doing is they go to the stall with those. As soon as the foal is born, they implement their protocols post-foaling. And then they leave the hand wipes out there. They zip time to the stall for the first 5 days of life so the grooms can wash their hands after touching or before touching the foal. Then they take that foaling kit. They have somebody on their day shift that cleans it, that's responsible for cleaning it, restocking it, and goes into a cupboard. And that is their protocol. And they restock it with all new supplies, except for the chains that are in Ziploc bags. They can wipe the outside of that bag off very easily with soap and water and a disinfectant of choice. And that is an easy way of preventing problems with those big foaling carts like I showed you before. Next slide. Biosecurity assessment. Take a look at the facility. This facility was having wood. A wood barn, not ideal. And they were using pads in their foaling barn. You don't need pads on the walls of your foaling facility unless your mare's planning to box in there and throw the foal against the wall when she foals, which isn't going to happen. What I'm trying to say is these pads are fomite. You had salmonella all behind this pad of this stall. We got rid of it. They have dirt floors. Next slide. Now, this gentleman is not going to make a whole new facility, design a whole new facility. You got to work with what you have. They have dirt floors. This is their tack room. I mean, look, they have everything in there. A drill. I mean, it looks like their automobile shop at the same time. I mean, keep it clean. Next slide. You see the dirt floors. Again, use elbow grease to really clean these stalls. And then at the same time, if you have wood, you have cracks and crevices in it, do the best you can to try to seal it. And what you can use, next slide, is polyurethane. This is spar polyurethane. It's good for outdoor use. When temperature changes, you may have to do it every couple of years. But again, if you're not going to build a whole new facility, if you have wood stalls, then try to use polyurethane after it's cleaned to seal up any pores. Next slide. Same bar as salmonella. What about their hand hygiene? Look at that. I see their paper towels on the left-hand side. I don't see any hand soap. There's paper towels. If you have a wet hand, grab that roll. You're going to contaminate the entire roll. This client had salmonella on their TV remote and on the handle to their sink right there. Poor hand hygiene. Next. And that's the biggest problem we have. We have a 20-stall barn with only one sink. What are we going to do? How do you mitigate this? How do you do proper hand hygiene? And look at that facility. I mean, when you have a facility like this, I doubt if their hand hygiene is that good. Next slide. How about this one? I don't see any soap. I don't see any towels. This is their sink. This is a Clostridium difficile outbreak. And what they did is they treat foals, sick and non-sick foals, with syringes full of medication or probiotics that what this client wanted to use. And then what they ended up doing is put them into the sink, and they played musical chairs with the syringes. So they so-called clean the syringes out that may have been in a foal's mouth that was sick. They fill it up with whatever medication they want, or gastroprotectant they want, or probiotic they want. They may make 10 of them, and then they go to the stalls again and give the foals the medications. And they may have just received a medication that was in the same syringe as a sick foal. What I'm trying to get to is keep clean. These syringes are not meant to be reused. Throw them out. I can't tell you how many times. I know we think about the environment and the waste of plastics. Either throw them out or be very cautious or responsible of cleaning out those syringes so you know only the same foal gets a syringe over and over again. You don't mix them. Next slide. Proper hand hygiene right here. You got dishwashing soap on your lower left right hand side. That's for dishes. You got hand soap that is on the wall. That is away. And what you could do, that's an infrared hand dispenser. You put your hand underneath there and a motion detector, it dispenses detergent on your hand or soap on your hand. Then you got a towel dispenser that dispenses the towels one at a time, so you can't contaminate the whole batch. Proper hand hygiene. Next slide. Muzzles. I hate these leather muzzles. Back in the day, that's all you have. And now you got nylon muzzles that you can wash, clean, disinfect. These leathers, it's impossible to disinfect. Impossible. I don't care if Secretariat or whoever had that muzzle on at one time. It is a fomite. Get something else. Next slide. Cleaning hand traffic every day. Anywhere your night watch crew could do this. They're not going to be busy 24/7, your night watchmen. They can go around, clean hand traffic daily, talk to your veterinarian about what is the best disinfectant for your facility, and you can get these disinfectant wipes and just wipe it down everywhere. Ledges, light switches, door handles, door pins. Clean it. Next. And hand hygiene. We've talked about this a million times with COVID. I'm going to give you some examples at a veterinary school. This is in Colorado State with Josie Traub did this study. Next slide. These are pretty much her slides. Okay, lower left. That is a veterinary student when they come into the facility. And those little white dots are colony forming units. So then they do a physical exam on a horse on the upper Petri plate at the 12 o'clock position, and then after ivory soap. The goal is to get your bacterial count in your hands to what it was before you arrived at the facility, which is the lower left. You look at it, that ivory soap did not do much. You know why? Because people only wash their hands for about 10 seconds. You got to give time for the detergent to work and get the organic debris off your hands. It has to be every bit of 30 seconds at minimum. And so they say when you wash your hands, 45 seconds to a minute. Nobody does that. But nowadays, they try to because of COVID. Next slide. So now this is with antibacterial soap. After the exam, before the exam on your left hand, after the exam on your right hand. So sometimes just the use of antibacterial soap can help enhance the activity if you can't wash your hands for 30 to 45 seconds for some reason. Antibacterial soap. Next slide. Now, how about the alcohol gels? Lower left, before the veterinary student arrived at the facility. After the physical exam is in the middle. On the right-hand side is going to be post. And that's using 67% alcohol dispenser. And that could be alcohol wipes. That could be your dispenser, what have you. Just shows. And your facility, if you don't have proper hand hygiene, talk to your veterinarian. Set up these soap alcohol gel dispensers around your facility. It may not be able to get all the dirt off your hands, but you can at least decrease the bioburden if you can't get the sink right away. Next slide. Number your stalls. This is just a schematic drawing. It just reminds you to number your stalls. Because if you have a positive stall, I can say, you know what? Foaling barn, stall number 8, you're having difficulties with, or I'm isolating a bacteria. If you don't have your stalls numbered, what am I going to say? The back of the barn, the second stall on the right, number your stalls or have an area to identify your stalls for the veterinarians, so we can be able to better implement protocols. Next slide. So I'd like to thank everybody today for your time and listening to this discussion, and just some quick examples of how to mitigate issues in regard to gastrointestinal disease in animals less than a year of age. Now I'm open for any sort of questions you may have. Thank you.
Nathan, thank you very much. That's a really comprehensive and useful presentation. I'm going to hand over to Andrew McGladdery, who has some questions for you.
Thank you very much, Nathan. That was a really exciting end to your talk, showing how hygiene really is an absolute critical aspect of dealing with foal diarrheas. I just sort of wanted to go back and maybe talk a little bit about some of the causal agents, in that I was really interested by your comments on rotavirus and rotavirus vaccination. I mean, we now have been using the rotavirus vaccine for a number of years. We've really, I think certainly from a clinical aspect, we've really felt a big difference to our problems with rotavirus. And we're not seeing those 3 or 4 year annual massive peaks with big rotavirus outbreaks, and that with widespread vaccination of nearly all the animals on individual farms, we're really seeing rotavirus as a much less, almost, I'd probably say almost insignificant cause of diarrhea at the moment in our population. So I just wondered in Kentucky whether the use of rotavirus vaccine was very widespread, or is it a case really of that animals are being exposed to burdens which maybe their vaccination status isn't protecting them from?
Yeah, no, it is quite widespread here in the thoroughbred population and the standardbred population within the state. The other breeds, the warm bloods, not as much so, or the quarter horses, but definitely the thoroughbred population, I would say 90 to, I won't say 100%, but quite a number of them still use the vaccine. And we're still seeing some occasional, in the younger foals, some diarrhea still occurring, but more so we're seeing in the 2 to 3 month old foals. And that's really causing significant problems here. Disease have really hit these foals hard. They'll pretty much denude their gastric mucosa, and they'll tend to get some pyloric strictures that we see. Clinically, it seems to be associated with more with rotavirus, not just strictly with rotavirus. You see the pyloric ulcers, but and that's where we got interested with the University of Kentucky, trying to partner with them and try to understand why we're seeing the more problems when before, 2 decades ago, when I first arrived here back in the late 90s, you didn't see much rotavirus at all. And now we're starting to see it trickle and get increase each year. And that's when we started seeing that new strain. And we found out the vaccine does not have that strain in it. And we try to talk to the vaccine companies, say, can you put the strain in? But the problem, they're in a conditional license with the United States, which they obtained, almost 30 years ago. And since it's a so-called boutique vaccine, in regards to the financial income they get off that vaccine is minimal. They said it would cost more to try to get it FDA approved now because they won't be able to get another conditional license if they add in a new strain. And so that is a problem, and we're still in talks with the vaccine company trying to help us here. So I think it's the diversity of the rotavirus. We don't know how much cross-protectivity they get with the new strain we're seeing here in central Kentucky. I can't comment on your part of the world.
Yeah, I think that's really interesting because I would say that when we're seeing rotavirus foals, they're often having very mild symptoms of diarrhea, and only perhaps where farms are actually more interested in testing to see what the cause of diarrhea is that we're picking up the rotavirus. I'm not sure we've really seen that different strain coming through. And I think, as far as I understand, our vaccine is identical to yours.
So it may be differences in strain.
Yeah.
And so you're essentially saying that the vaccine may not stop the problem entirely, but it significantly reduces the clinical signs. Yeah.
That's certainly the impression I have gotten over the years as well. I think we don't see the severe rotavirus cases that we saw 20 years ago now, nor the severity of the storms of rotavirus going through a farm. That's definitely a thing of the past, hopefully for carry on that one.
Nathan, just one of the other things, we've still got a number, I think, of farms using oral rotavirus plasma as a treatment of newborn foals routinely, or of foals who have got rotavirus, tested positive for rotavirus, part of a diarrhea episode. Have you got any comments or experience of that? Is that something that's used in the US still, or forgotten about now?
No, we haven't really used it like we did back in the 90s. We haven't really used it that often orally for the rotavirus, that is. For other organisms, we have played around with the Salmonella, given some of the hyperimmunized plasma. The donors have been vaccinated with Salmonella vaccine. We've given it orally, but I can't specifically comment on rotavirus. I don't have any experience with that.
Nick, have you got any questions? Okay. Well, listen, Nathan, thank you very much for joining us today. It's been a wonderful, really comprehensive presentation. So thanks once again for contributing to the series of lectures.
Oh, my pleasure. Thank you for inviting me, and I hope it was worthwhile. Thank you.